Good afternoon if you're joining us from the East Coast, and good morning if you're joining us from other parts of the country. Thank you for joining us for today's discussion on obstetrics and gynecology residency programs. Today's webinar is sponsored by the HMS Office for Diversity, Inclusion, and Community Partnership. The mission of the DICP is to advance diversity and inclusion in health, biomedical, behavioral, and STEM fields in ways that build individual and institutional capacity to achieve excellence, foster innovation, and to ensure equity in health locally, nationally, and globally. DICP efforts support the career development of junior faculty, trainees, and students, identify and train leaders in academic medicine and health policy, and provide programs that address crucial pipeline issues. Today's program is the 7th webinar in the 2021 Visiting Clerkship Program webinar series. For 30 years, the VCP has been a model of excellence, offering outstanding medical students, particularly those from underrepresented in medicine groups, an opportunity to participate in externships at HMS and its affiliate hospitals. Since its inception, over 1,500 students have rotated through the VCP. Obviously, the VCP has been drastically impacted by COVID-19, and we recognize there's lots of uncertainty in what the upcoming application cycle will look like for residents or for applicants for residency. With this in mind, we host a series of webinars to bring members of HMS residency programs and medical students together to share ideas, provide support, and address questions on transitioning to their next stage of their medical training. These webinars provide an opportunity to discuss the application process, address questions from students, regardless of regarding away rotations or the lack thereof, as well as other concerns that students may have. Just a couple housekeeping notes for today's session. The chat is not available and everyone's microphone will be muted aside from our participants. If you have questions for our panelists, use the Q&A function to post those questions. And yes, the webinar will be recorded and will be posted on the DICP website in the next few days, if not by next week. So with that, I want to transition and introduce myself very briefly. My name is Dr. Alden Landry. I'm an emergency medicine physician at Beth Israel Deaconess Medical Center, and I'm the Assistant Dean for Diversity, Inclusion, and Community Partnership. And I am also someone who has participated in pipeline programs such as the Visiting Clerkship program. We're joined by two wonderful representatives of the respective OBGYN programs affiliated with Harvard. We have first Ms. Yara Nunez, who is the program manager for the combined MGH Brigham Integrated Residency Program in Obstetrics and Gynecology. And we also have Dr. Brett Young, who is the program director for the BIDMC OBGYN Residency. And with that, I want to turn it over to the both of you because students are here because they want to hear about your programs. So Ms. Nunez, can you tell us a little bit about the MGH Brigham program? I believe you're on mute, Yara.
Sorry, I muted myself. The Brigham Mass General Integrated Program is a 44 resident training program, 11 residents per year. Residents spend about 60% of their time at Brigham and Women's Hospital and about 30% of the time at Mass General Hospital. They also do rotations at Boston Children's Hospital, New England Wellesley Hospital, and Brigham and Women's Faulkner. We have an array of curriculums such as, and we have committees such as Resident Wellness Committee, our Diversity and Inclusion Committee, and our Just Culture. Our curriculums include family planning, advocacy, as well as all the obstetrics and gynecology subspecialties, which residents will rotate throughout the year. We have 11 rotations per year for residents, and we have a research rotation in our 3rd year that the residents can use either to do research or to do electives training whenever we don't have COVID globally, if they would like, or nationally. And we have funding for that, to help mitigate some of the costs. We also have a really strong research curriculum and a lot of resources to do research at our program. I think that's a quick introduction to our residency.
Wonderful, thank you for sharing. And Dr. Young?
Yeah, thank you, Dr. Landry, for the invitation and welcome. Thanks for joining. The Beth Israel Deaconess Medical Center program is a program 24 residents, 6 per year, obviously. We have a holistic review of our applicants, which I'm happy to talk about later, with really robust clinical opportunities with our residents graduating typically in the 80th to 90th percentile for surgical opportunities in the country, with a really robust research department division within the department, which really is there to support our trainees and faculties. We have a lot of our residents have really strong interests in community and global health, with the opportunity to do away rotations in Botswana, as well as community engagement in continuity clinics at one of our many community health centers. That's something that we really value. And we really try to individualize and meet our residents and what passion that they bring to the residency. And that's really what we're looking for. We're looking for passionate residents who are going to engage in advocacy, community health work. And so we have 2 electives that are protected times during one during the second year, one during the third year, to really promote their career development or do something that they wouldn't otherwise be able to do during their other rotations. We have a residence teacher program, as well as a simulation curriculum, our own simulation center here on site, to allow residents to get really great hands-on surgical training before they go into the operating room, or if they need to work on something afterwards, and really phenomenal board pass rates and top fellowship matches if that's what our residents want to do, with about 50% of our residents going into fellowship and 50% of our residents not going into fellowship. And our job really is to train phenomenally trained residents, and then to make them become physicians that are humanistic in the care for their patients. So thank you again for the opportunity.
Wonderful. And thank you both for your introductions or your residency programs. Really want to just jump right into questions and try and address as many questions from the audience as possible. But we do have a couple questions that I think will help organize this discussion and make it flow a little bit better as we sort of walk through the approach to the application season, which is actually just coming up on us really soon. So Yara, can you give us an overview of the timeline for this year's application season? And also, how are you preparing this application season, given that it's a little bit different from prior years?
Yes, of course. I forgot to mention really briefly that Dr. Stagg really wanted to be here, our program director, but she had a family emergency, and that's why I'm covering in for her. So our timeline for applications, once applications become available to us on September 15th, we'll begin to divide them into groups and distributing them to our review committee. Our review committee will have a little over 4 weeks, which allows for the October 1st release of the Dean's Letter to review all the applications. We review every single one of the applications we receive. And once we break that down, we dwindle that down, we will be sending out invitations to interview on October 19 as per ACOG guidelines. You will receive the invitations early in the morning, and then we'll allow people to sign up for interviews in the evening. That way everybody gets a fair chance for those that are in the later time zones. Then our interviews, we have 2 interview days and 4 sessions. So our first interview day is Friday, November 19th, and we have a morning session starting at around 9 a.m. and an afternoon session starting around 1 p.m. And we have a second and last interview day on December 10th, again with a morning session at 9 and an afternoon session at 1. Prior to our interview days, the evening before, on November 18th in the evening, we'll have a resident gathering. It's actually a really nice, it'll be once again, this is all going to be virtual as per ACOG guidelines. And the residents have an evening event, and they have, they split everyone into groups, and that way you can, each applicant will have time with about 10 to 20 residents by group to discuss any questions they might have about the residency program.
Wonderful. And for you, Brett, given the uncertainty about the upcoming application season, and it's great to hear about the ACOG guidelines, because I think you all are leaps and bounds ahead of other specialties as far as just organization overall. Do you have any recommendations for students as they go about this process in preparing their applications?
Yeah, I guess what I would say is that virtual interviews went really smoothly last year, and the majority of the programs actually were surveyed, and the majority of programs nationwide really enjoyed the virtual program. And I think that it really kind of flattens in a way and creates a lot of equity for all of our applicants. So I'm a big fan of virtual interviews. And I guess for preparation purposes, just as if you were coming in person, really think about why are you passionate about applying to OBGYN? Why are you passionate about, whatever program that you are applying to? And what is it, all of you can offer so many strengths, to our programs, and what is it that you can offer? And really think about kind of answering, those questions and be ready to tell your story, because we're ready to hear it. And we really, again, I think when we review programs holistically, the opportunity to talk virtually, and you can set up your room or location for the virtual interview, however you think you're most comfortable with. But we're looking forward to hearing what you have to say and tell us about your story. And so I guess that's what I would just give you the guidance, leave you with that guidance, and that we're excited to hear from you, and looking forward to having you interview and apply.
Awesome. I think those words of encouragement are really important for students to hear at this time. And just for clarification, your applications are available for you to start submitting on September 1st. You don't have to have your application completed by September 1st, but that's the time when you could start submitting your applications. That said, residency programs won't be able to fully view your applications until September 29th. And at that same time is when your Dean's letter is going to be available. So we're going to review applications starting that September 29th. And I can, speaking from the conversations I've had with other program directors as a part of this series, the program directors really get excited on that date because they know they get to start meeting you all, at least on paper. And so it really behooves you to have your application ready so that September 29th, your application is in with everyone else. So make sure that you have everything ready to go. You can start submitting, putting your application together now, but the earliest you can submit is September 1st. And the latest you really want to be submitting is September 29th when the program directors start downloading those applications. So I want to transition to something that we're just now opening up here at Harvard, but not a lot of students are able to take advantage of, and that's away rotations. And it's been something that's been really important in the past. Obviously, with COVID and restrictions on travel, it really hampered us. And last year, we weren't able to host students as part of our visiting clerkship program, hence why we started doing these webinars. But now we're able to do it again. And students are definitely interested in doing away rotations, but unfortunately, it's a really narrow window for students to do so. So Yara, how will away rotations be viewed by programs this application season?
So while away rotations are always very beneficial, they're not a requirement. And for us, it is more important that students do well in their sub-Is. And because, when we are viewing applications, we take a holistic approach to reviewing applications. So we're looking at all the different elements that make up the application, and not being able to do an away rotation, especially given COVID, is not gonna hamper you. Is doing, well in your sub-Is that really matters when looking at an application.
And similar question to you, Brett. If people aren't able to secure away rotations, let's say they tried to, but for one reason or another, they weren't able to secure an away rotation, what should students be thinking? How should they be thinking about this process? And what should they do to make sure that they're putting themselves in the best position to succeed?
Yeah, thanks for the question. I echo what Yara said, that having not done an away rotation in no way hurts an applicant. And sometimes, applicants come and they do an away rotation from their other medical school here, and we find out that, maybe this is not, our program is not what an applicant is looking for, and it's not going to be the best fit. And so just because an applicant did an away rotation at our site, sometimes we find out, it's not going to be a good fit. So just because you did not do an away rotation, actually it's not part of our review process. It doesn't help necessarily or harm you. So I would say it's really, again, similar to what Yara said, that doing well on site is really important with your core clerkships and your sub-Is.
And just to note, just to reiterate what Brett just said, away rotations are a two-way street. It's a way for you to get to know the program and see the program from the inside out. But it's also a time where programs will be evaluating you and seeing how you compare to their newly minted interns as far as your skills, knowledge, attitudes, and behaviors towards the specialty. And so it's really important for you to come into those situations with a strong basis and making sure that you had a strong sub-I performance at your home institution is really important. And maybe not doing away rotation is actually a good thing this year, just because you want to shore up those skills before you make that transition to the application process. And then again, there's also the cost and the uncertainty that's happening with COVID. So while it may work for some, it may not work for others. And I think you have to think about yourself as an individual and not necessarily compare yourself to what other students may be doing when it comes to away rotations. I mentioned that doing away rotations is a way for people to learn about programs and see programs from the inside out. But Yara, if a student has a particular interest in a program, how should they go about letting the program know that they're interested in the program, since they may not be doing away rotations there?
So, it is really important for us as a program to be as fair and transparent as possible when considering each application. Students are welcome to email us their interests in our program. However, we have a process in place that we believe is the fairest way to determine who we will be inviting to interview. And we have to follow that process in order to be fair to each of the people, of the applicants, applying to our program this year.
And so, Brett, is there value to reaching out to current residents in the program to learn about what the program is like, or maybe even to some faculty members to find out more about the program?
Yeah, thanks, Alden. I think that reaching out, you're always welcome to reach out to residents and faculty members. If you are chosen to interview, you will have that opportunity. And similar to what Yara said, we'll have a social night before our virtual social night to meet our residents ahead of time. And you're always willing to and welcome to reach out to our residents and faculty members. And if you wanted specific questions, we're happy to answer them, but certainly not necessary to do that, as we have a similar process as Yara described to really make sure that we're flattening the playing field for all of our applicants.
I hear this all the time from trainee or applicants when they're going through the process, and they'll say, "Oh, I emailed the program and I didn't hear back from them." That doesn't necessarily mean that there's any ill intent, or they aren't interested in you, but they just have a process to go through it. So it's really helpful for students to know that. And I think we also try and put together programs like this so that all students can get the same information, as opposed to getting different levels of information and feedback. I will caution to those students that are joining us, just be careful about your sources of information, especially if it's not coming from the programs themselves. A lot of students like to go on forums and get information about programs. Those forums aren't necessarily accurate and don't represent the programs, and they may be one person's experience. And so I encourage you to really think about the sources of information that you're getting information about programs. And if you have a question that isn't answered on the website for the program, email the program. Haven't been able to speak to a trainee, and you would like to know a little bit more about the setup of the program, that it may not fit within the typical sources of information. The programs are the best sources for this information, as opposed to those forums that may be out there. We are talking about September 1st and that submission date for applications. But a lot of the application process has already started, and with students and their performances on their sub-Is and getting letters and so on and so forth. But Yara, is there a way that a student can overcome a poor performance on maybe a step 1 or a core clerkship? And if so, how do they put that forward in their application?
So as we already noted, we do look at the entire application, every single element of the application. And while the academics are important, there are other important elements of an application. There's your volunteer work, your work experience, your letters of recommendation, and your personal statement. Students can take the time, if they wish, to use their personal statement to explain any extraneous circumstances that could explain why they perform poorly, or they can also use it to highlight other elements of their application that, they want to promote, that can show that, maybe they did poorly at this, but they were great at these other things. And so, it's just, one thing is not gonna like completely end your chances of coming to interview. It is important for us to like look at the whole picture of who the applicant is.
And Brett, some students have put together the applications and they have most of the pieces together, but they may not have taken step 2. How important is it to get that step 2 grade in prior to the application process? And if so, will that impact their application at all?
Thanks for the question. No, it does not impact your application. It's ideal if you can get that in. It's another piece of information that could, potentially help you, but it's not necessary. And I echo what Yara said about if there were extenuating circumstances, then use your personal statement or potentially have an advisor of yours contact program leadership to review or explain any extenuating circumstances such as a failed course or a suboptimal step 1 score or suboptimal step 2 score. And we again put that all kind of into a holistic review of applications.
Great. And we'll touch on that comment you made about letters of recommendation in a second. So I want to cycle back to that. Yara, any thoughts on what students should be putting in a personal statement? Is there anything that really pops or shines when you're reviewing personal statements? And then also, just as a secondary question to that, we've all been impacted by COVID. It's universal. All of us have had disruptions in our careers and our development. What degree should we be commenting on COVID in our personal statements, if at all?
I think that students should take the opportunity in their personal statement to include any information that we can't infer or that they are unable to add to their application, to highlight anything that we can't like see there, or they can talk about what sparked their interest in OBGYN. That's always a very interesting thing to read, because there's all kinds of reasons why students go into OBGYN, and it's always interesting to see what sparked that interest. And as for COVID, I think it would be hard in a way not for students to mention COVID. I'll be honest, it's been such a transformative experience for like every single person in the world. If they, by the end of their medical school, it would have been a bigger part of their medical school than not having dealt with COVID. So I think, they can choose to mention, whatever they feel important, but they shouldn't feel like they can't mention it. I think everyone would understand that, it has now become an important element of their education because it has transformed the way that they are getting educated and prepared for residency.
Yeah, thank you for that. And I think it's just really helpful for students because I've been forwarded a couple personal statements to review for applicants. And, they're like, should I take this paragraph out? I talk about COVID. And I said, well, the biggest thing is these statements need to be personal. And they need to make a statement about you. And if you have something that is meaningful and impactful, that really helps to share your narrative, share your story, then include it. But if it's something that's generic, I think that's the part that needs to come out. We all know that medical school was disrupted. We all know that, people were pulled off of clerkships and things along those lines. But is there a personal, is there a personal connection that needs to be brought out in the form of the personal statement? Another place that there's some leeway in the conversation is the letter of recommendations. And so, Brett, can you talk to students and tell them what they should be looking for both in a letter writer, and then how can they help that letter writer write the best letter of recommendation for them?
Yeah, another great question. So letters of recommendation are really important when I review an application, because those letter of recommendation writers are going to know you hopefully really well. And so I think the most important thing is when you're picking your letter of recommendation writers, they should know you well. So that might be, if you have done some international health work, it might be someone who you really, you were in another country and you worked side by side with. It may be someone who really knows you from when you're sub-Is. It may be someone who knows you through some of your research work. or through an NGO that you worked for, whatever the, and I think you can use them, your letter writers, to tell a story. So I would think about having a letter writer from kind of one piece of, maybe one part of your life, and then another part of your life, and then another part of your life. But I think the most important thing is that they should know you really, really well. And I unfortunately have read letters of recommendation from a very prestigious clinician who has used the wrong pronoun or has used typos, and that's really unfortunate, because I read that and then I think, wow, maybe that letter writer really doesn't know the applicant very well. And so the fact that someone may be an assistant professor or an instructor, or maybe not even a physician, it really doesn't matter to me. I'm really looking for someone who can tell me a little bit more about you as a person, about your work ethic, about your passion. And I keep using that word passion, but it's really important to me. Tell me really to get to know you as an individual. And I really do read those. I mean, literally like line for line. So I think you should know your letter writers. They should know you really well. And tell me a little bit more about your story and who you are and what you're going to give to our residency and the development of you as a physician.
And you make such a great point, because oftentimes we think we need the oldest individual in the room, the person with the most seniority, the person with, the gray hairs or the bald head who's been around the block a few times to really be the one writing that letter. But in actuality, they may be so distant from the experience, and they may be distant from you as an individual, that they can actually speak to you and the work that you're doing. And so it's really important to identify individuals who know you well, who could talk about your strengths and talk about what your future is in the specialty to really support your letter. And just a couple pro tips that I found really helpful for me as someone who writes letters of recommendation. If you have your application together, share that with the person who's going to be writing your letter. Or if you have your personal statement together, share that with them. Otherwise, give them a copy of your resume, and that way they can maybe pull out some things to discuss. And I really like your point, Brett, about making sure that the letter writers maybe have different perspectives of you, because then, one person can talk about your different lived experiences, and it helps us as we review applications to really understand how you tick as a person and what you're capable of, and not just seeing you from, the same vantage point over and over again. So I think that was really good advice. Yara, I have to commend OB and ACOG, because I think you all were the first to say we're going to do virtual interviews this year. And I know a lot of other specialties are slowly coming onto that. But, doing things virtually comes at a cost. So how would you advise students to make sure that they shine during these virtual interviews?
I mean, I would give them this advice if they were interviewing in person too, is to be themselves always. By the time they come to our interview or, the virtual interview, at least 5 people have read their application through. So they are well known on paper, but we want the interview to see who they are as a person and to learn what, we can't extrapolate through the application. And I know it's an extremely nerve-wracking and intimidating experience, but, know that on the other side, we're all really nervous too. So it's not like a one-way street of nervousness. It's, we want to get to know you, and we want you to get to know us too. So, we're just as nervous and as eager to show off who we are and what we can bring to the table, because this is a partnership at the end of the day, and so I would say, just truly be yourselves. Last year for our first ever virtual interviews, I sent all the applicants pro tips about the best ways to interview. And it was just basic stuff about the background and make sure your headphones were on and you had good posture and your face was square and all that kind of stuff, little things that actually they're little, but they matter in the end. So you'll get pro tips for most programs just about the genetics of it, but all you really have to do is bring yourself to it and bring who you are and just be the person that if you match with us is going to show up on June 14th or whatever it is that our first hire date is.
Awesome. Thank you for that advice. And I think we've been in the Zoom world enough to make sure that we all know we have good internet connections and a quiet place in order to participate. And I think that's the bare minimum from a tech standpoint. But as Yara said, just be yourself. I think that's really important. Brett, we're just jumping ahead towards the end of this entire process when students are putting together their rank list. They've done their interviews and they're considering, what programs to rank where. Are there any special considerations that students should be doing, or maybe some things that they shouldn't be doing when they're considering creating that rank list?
Yeah, I guess the advice that I would give you, that everyone should be giving you, is to really rank based on where you want to be. This match, the NRMP, is set up to really, it's based on you. And so it's not based on the programs. And so really you should be ranking the program that you feel like is going to meet the most of your priorities. There's probably never going to be a perfect program, but where are you going to, and I really like Yara's comment about a partnership. This is really a partnership, and we want, the purpose of interviews is to find the fit. And we want to be able to support you as a program to become the physician that you want to be. And so, and that's a 4-year process, and it's an amazing process. And, but really rank the programs that you feel like are going to provide you with the support and the training and to meet the priorities that you are putting forth as you think about becoming the physician you want to be. So really top program that you think is a fit and rank from there.
Awesome. And try not to play the whole mind games of, oh, I got a good vibe from this program, and so I'm going to rate them higher. Because in the end, I think what you said, Brett, is important. Go where you're going to be the happiest. And I think find the program that fit with you. And I've come across trainee or applicants who've had these really complicated ranking lists where they would put scores in for every part of their experience, and they would use algorithms. And I'm someone who goes a lot more by gut, and you know if a program's right for you because of the conversations that you've had and the people that you met during the interview day and the sort of the resident experience in those conversations that you have, that whereas us faculty aren't there, and you get a sense of where you're going to be the happiest. So try not to complicate this process, and as much as it doesn't sound that way, Brett is right. The program is set up so that you all, the applicant benefits, and this is set up for their success. So I want to pivot and not necessarily talk about the application, but talk about your programs a little bit more in depth. And so Yara, as we discuss physician wellness, trainee burnout, can you tell me a little bit about what your program is doing to support trainees and address issues related to burnout?
Yes, so our program has a really well-established wellness committee. It's been, I think, 5 years since we established it. And it is, they're both faculty and resident members of the committee, but it is run by our residents. And they have planned throughout the year events and activities to help maintain resident wellness and mindfulness. We also have a weekend-long retreat for each individual class in the spring. This is all covered and paid for by the program. And they can, do have dinner together, all the food and all the activities are paid for by the program. So it's just for them. And it's like one of those rare occasions where the entire class can get together because, given all the call in the different hospitals we have to cover, rarely will a class be able to get together all together. So we have created this for them. So it's something for them to really, look forward to. And we also participate in the CREOC Wellness Week. And we do all these crazy, last year they did this crazy Peloton between the residents and the faculty, and they had these teams. And, it was just something really entertaining and engaging for the residents. The residents loved it. It got actually really crazy competitive, but it was just a really fun way. And they, at the end of the day, the residents are extremely competitive, so we do try to keep this in mind. And the faculty is always really happy to participate also in these things and to help promote the wellness and, mindfulness for residents.
Awesome. And Brett, we hear a lot in the media about Boston and racism and whatnot. And people always question, well, what's the culture like in Boston? And as you think about your UIM trainees who've come through the program, who've graduated and gone on to other places or stayed here in Boston, have they shared with you any of their experiences about living here in Boston and what it's like as far as culture and climate?
Yeah, thanks for the question. It's obviously a very hard question to answer in 1 minute. There is systemic racism everywhere. If we didn't acknowledge that, if I didn't tell you that there was not systemic racism in Boston, then I wouldn't be telling the truth. And I think the most important thing is to recognize it, to be progressive about it, and see how we can change it and be better. And so I am not a UIM myself. I identify as Caucasian. I am an ally. We have in our hospital and in the residency, we have ongoing multiple committees. We have multiple advocacy groups. We have an advocacy chief resident who has the sole position of supporting our UIM residents and also telling all of our residents about opportunities in Boston and in the area about how we can be advocates for each other and advocates for our patients. We, again, have a lot of strong interest in community health, and that goes hand in hand with kind of meeting our patients where they are, regardless of their self-described race or ethnicity. And so I think it's something that we, as a program, as a hospital, as a city, are continuing to work on. We currently have, just as you spoke about Boston, Alden, we have a current interim mayor, Kim Janey, who is awesome and identifies as African American. And so I think that we need to be better, but there are ongoing seminars in the hospital, advocacy groups in the hospital, advocacy committees for UIM residents and trainees, and certainly our collaboration with Harvard, which Alden, obviously you've made wonderful strides with doing and being an advocate. So much more to come, but we really try to be progressive in our department on issues of diversity and advocacy, and we can always be better. But as an example, 25% to 30% of our grand rounds last year were on issues related to these types of issues. So it's something that we need to keep talking about, we need to be better about, and be partners with our UIM residents to make sure that they feel individually supported.
Thank you for that. And this is just purely as a commentary, as someone who's been in this space coming from the South, from both undergrad in medical school and then living here in Boston, just to drive home the point that unfortunately racism is going to be wherever you go. And I think you need to find a place that you will be comfortable and you will feel supported. And it's great to hear about the efforts that are happening, not just at in your residency program, but across the hospital, to helping to make it so that the residents feel like they belong. And I can say that in my role at HMS and interfacing with the other teaching hospitals, I think we really strive to not just talk about diversity and inclusion, but the importance of feeling belonging and making sure that our trainees feel as if they belong here and they are supported along the way. So that goes for both the MGH Brigham programs as well as the BI programs. And speaking of which, Yara, we're having a discussion where there's 2 residency programs on the same webinar. And can you share your thoughts about the relationships between the Harvard teaching hospitals? Is it a cordial relationship? Do we get along?
We get along plenty fine. Yeah, no, I mean, it's I was just when Brett's slide was up, I noticed that Huma is your associate program director. Huma is a former resident of mine. It's actually one of my first residents. So, and I love her. She's amazing. And so, yes, like we have a lot of colleagues who have been at, gone to each other's programs, and we have residents who are actually, I think I sent one of my residents this year over there, Dr. Donovan. So, it's nice. There's a lot of, mingling among the the residencies, which is really nice. And it's, it's great because each program has like different aspects of the training that they offer. And it's really nice to have all that like different points of view coming, and going between each program.
Awesome, thank you. And I think it's really important to know that it's not uncommon for one person to interview and match at one program, and then for their next stage of their career for fellowship training to go to the other hospitals and then maybe get their first attending job at the third hospital. And so they've gotten the true Harvard experience by visiting all of the different hospitals. And so that is not uncommon. I saw, Brett, you raised your hand. Yeah, you disappeared for a little bit and they came back. So that's the case. And then lastly, as we're about to wrap up, I'll go to you first, Brett, and then to you, Yara. Any final words of advice for students as we close up this webinar? Anything that students should hear that we haven't discussed?
Yeah, I guess that what I would just emphasize, and if hopefully you have heard it from me, that we want to hear about your story. We want to hear about, Alden used what makes you tick. We really want to hear about who you are as a person, what you're going to bring to your training as a resident. And, I'm really looking for, to be honest with you, a resident who is going to have resilience, who's going to work really hard, who's going to give to others. And when I think, Alden, you used a phrase that I use a lot of knowledge, skills, and attitudes. And I'm kind of the opinion that I can teach, just about any sort of knowledge. I can teach just about any sort of skill, and my faculty can. And it's that attitude that I think is harder to teach. And so what I'm really looking for, and I know that all of the, people who interview at our program, we have a very rigorous process too, as Yara also described, and for her program, I know that you all who are interviewing can do the work. And what we're really looking for is a fit and kind of the attitude that you're going to bring to your training. And I look at my residents and I see how resilient they are, and I know all of their personal stories. And that's really what I'm looking for in your application and during the interview. So just come and let's see if it's going to be a good fit, because we do want you happy during your 4 years, because it really truly is a partnership. 4 years is a long time. And who knows, maybe it would be, a phenomenal fit as a faculty member. And I trained here as a resident, and then I went over to the Mass General Hospital for my fellowship training, and then I came back as a faculty. And so we really are looking for we want you to have a good fit, and we want to have a good fit. And that's really the purpose of the matching process and of the interviews. So I guess those would be my final words.
Awesome, thank you. And Yara, any closing comments?
I echo everything Dr. Young said. I think, we want someone who can work hard, because we are an extremely busy hospital, both extremely busy hospitals, but also be part of a big family. You will have 43 other, family members, because they will be part of your life in a way, or your own family will not be for the next 4 years. And also just diversity of points of view and experience, and training, medical training. We welcome that. I think that enriches the program so much, enriches our program we have residents literally from all over the world, right? Like Ireland and Africa and all over the United States, Canada. And that enriches us as a program, because we have all these different perspectives coming in. And that's really important to us, because it makes our training better, because we can, change things that, that might not be working, that could have worked in a different program. All that perspective works. And we want residents who can speak up and help us make the best program available, because again, this is a partnership. We want to help us have the best training program possible. And we want you to have the best experience in the next 4 years, and the best, way for you to learn and to be the OBGYN doctor that you want to be. And so it is a collaboration. And we are here to support you in your training, in research, and in your life. Amy is the residency mom. Literally, that's what the residents call her, the residency mom, and I'm your big sister. So, we're here to take care of you and help you in this journey, really, of your life, because it is, an integral part of your life. It really will become that. And so, I would say, just come as as yourself and, bring that, because each and every one of you has something special to offer to any program.
Thank you for that. And I think this is a good time for us to go ahead and wrap up. I want to say thank you to Ms. Yara Nunez, the program manager for the combined Brigham MGH residency program, and Dr. Brett Young, the program director for the BIDMC residency program. We do have a very brief survey that we'd like for you to click through. It's about 4 questions. It'd be really helpful for you to give us some feedback. I also just want to draw your attention to the left-hand column of your screen, where you can see some of the contact information for our various Twitter handles and residency programs. If you'd like to learn more, see what we're doing, get a different perspective of the residency programs, please be sure to do that. Quick update, we have a couple other webinars that we're going to be hosting. We're going to be doing a conversation like this on anesthesia, and then also a conversation around surgical subspecialties, and those are listed both for August 10th and August 31st. And of course, our residency showcase, which is going to be virtual this year. It's going to be on September 11th. We look forward to seeing you there and joining and learning more about the programs, and really having an opportunity to interface with some of the trainees that we're inviting to participate. And if you have any other questions or you want to review this webinar, it's going to be posted on our DICP website. And again, thank you to the students for joining us. Good luck in the application process. We look forward to seeing you on the interview trail. And we look forward to seeing you hopefully joining our training programs come June of next year. And it's going to go a lot quicker than you realize. And with that, thank you to Jasmine and Teresa and to Susan in the background for helping organize this session. And we wish everyone a happy rest of the day. Take care.
Thank you so much.
Thank you. Appreciate it.
Bye-bye.
Bye.